So Intermountain and HRSA have been very flexible with us in this project. So we have been able to implement not only the telecrisis line in our local critical access hospitals ER to help those in their greatest moments of need, but also have been able to implement outpatient care via community health workers and a local psych mental health nurse practitioner. So the community has been able to receive this much needed mental health resource and care coordination that did not exist prior to this grant project. And it's helping us to bring down those moments of greatest need, of course, and decrease the frequency and the intensity. And we hope to continue that going forward. We have actually served over 300 people in our community, and we are a very large county. We're about 1,700 square miles, but population wise, we have about 3,000 people, 3,300 people in our county. So almost 10% have been able to get services through us. I would definitely say be flexible, and whenever possible, try to think outside the box, especially in a pinch. One of our biggest challenges when we started the project was the difference in licensing LCSWs in Montana and Utah. So this caused some delays in implementing the telecrisis services at the rural sites. So during this time, rather than sit and wait, we got creative and spent that time building the outpatient services. So we were utilizing our network that we had created locally. And through that, we have some very successful partnerships with folks who can actually specialize in outreach and relationship management to help create those connections and best understand the needs of ours and our surrounding communities. So with all that input, we requested some readjustments to the budget. And as I said, flexibility was key. And we were able to come up with services that filled the gaps when we needed them filled in our communities while we were waiting for the telecrisis licenses to come through. It's been amazing and vital to the area that I live in here in Granite County. We're now serving all three of our little local schools, who unfortunately the company that was covering their mental health needs and some of their special teams actually pulled out. And so there was no one to serve the schools. But luckily we had recruited an amazing community health worker who is actually working on her licensure as a clinical social worker here in Montana and is focused on children. And so we've been able to take this need from all three of our little tiny schools, and she is slammed. She's very busy. We have now partnered with the schools, and she's actually sitting in space in the schools. So there's even less disruption to the kids' days. They can just go straight to her office, get the services they need. It's directly with the parents. So the parents sign all the intake, all of that. We were able to add a second community health worker who is also an RN. So that's been amazing too. She's able to do health coaching for free through this grant. She's able to do some community education. She does a sit and fit class. You know, with a population that's so isolated all the time, especially our elderly populations, it's pretty cool to see them coming together and sit and fit turning into more of like a social hour, or, you know, just getting them out of their house. You know, we all know that mental health and whole health and well-being go hand in hand. It's all the same thing, right? If you ask me. And so it's pretty amazing we've been able to do that. Our sheriff's department is able to call on our psych nurse practitioner for, you know, the needs when maybe they have something more acute. She'll walk right over to the jail. We actually are situated and located in our courthouse. So we're actually in county space, which has been pretty handy for people. We find that helps also reduce stigma. You know, you never know why somebody's at the courthouse. It's all really working hand in hand, and we've brought a lot to the community in a very short amount of time. I think I think we learned during the pandemic that human connections are important. And even if those have to happen over the computer or phone, a connection is still a connection. I do think maybe, especially in my rural community before COVID, that may not have been the thought process for people. And so having the ability through these community health workers to say, "Hey, this isn't that scary. I'll help connect you. I'll help you with your first telehealth appointment," or, having this easy we have this easy appointment setting where you just basically get a link and you don't have to download anything. You just click that link and you're on with, the psych nurse practitioner. And so none of us can live and thrive in our own little bubbles, right? So this project has helped us to create that connection for people here in rural Montana. And whether that be in our office or over telehealth, or even better, I say a blend of the two. Um, we're working to sustain those efforts so that people don't have to go back to feeling like they can't connect that way, or that isn't an option, or they're just on their own in their own little bubbles out there.